Acute injuries. The most commonly reported acute injuries are sprains and strains. Sprain is defined as stretching or tearing of ligaments and may result permanent laxity and decreased joint stability. Strain refers to a stretching or tearing of a muscle or tendon and may result from an active contraction against a resistance or passive stretching. Ligaments sprains may be divided into different degrees of severity, from pain without ligament laxity to a complete ligament tear. Medial and lateral collateral ligament sprains of the knee can occur during squats, lunges, and leg presses, or with improper lower extremity placement. Meniscus or cartilage tears associated with rotational movements and stress can occur with squat and deadlifts. Muscle strains and ruptures are painful and present with limited range of motion, loss of strength, and tenderness. The tendons that frequently rupture include the hamstrings, biceps, patellar, pectoralis major, and triceps. The most common strain involves the paraspinous musculature. Pelvic avulsion. Excessive tension placed on a tendon insertion into bone can cause an avulsion fracture. The most common is the avulsion from the anterior superior iliac spine (ACS), the ischial apophysis, and hamstring origin. Most of the apophyseal avulsions occur in people with immature skeletal. Biceps tendon rupture usually occurs when an individual is lifting a heavy object. In the past, these injuries were frequently work-related. Currently, most such reported injuries occur with weightlifting activities, most commonly biceps curls. Acute fractures. There are few reported fractures caused by weightlifting. Most are upper extremity fractures. Overuse injuries. Chronic injuries often result from overuse injuries, particularly if the injury is ignored. In weightlifting, the body is required to put heavy stress of the ligaments, tendon, and musculature. Tendinitis is probably the most common overuse injury seen in weight training. Often, overuse injuries occur because of incorrect exercise technique or excessive repetition of movements performed against weight. Rotator cuff injury are often the result of muscle imbalances, weakness, and repetitive loading activities. The rotator cuff stabilizes the humerus so the larger muscles can lift heavier weights. The rotator cuff strain is often the result of the weight attempted posing too much stress for the small calf muscles used to stabilize the joint. Weight training activities associated with these injuries include the military press, rowing, bench press, and pectoralis machines. Therefore, it is important to access the strength of all the musculature in the shoulder, especially the posterior shoulder and external rotators. Rehabilitation of these weak muscles is often the key to resolving pain. Secondly, the range of motion. The range of motion in the shoulder needs to be tested and corrected. Often the external and internal rotator muscles become tight and limit the range. Anterior shoulder instability. An athlete with anterior shoulder instability will report looseness, transient numbness, and apprehension about the shoulder going out of joint. The bench press produces hyperextension of the shoulder musculature and can cause repetitive shoulder capsule trauma and may also disrupt the AC joint. An often problematic exercise is the reverse behind neck military pull down. This exercise often causes shoulder capsule loading and inferior glenohumeral ligament sprain. Neuropathies. Nerve injuries, often the result of constriction for muscle hypertrophy, present with pain or paresthesias as well as muscle weakness. Repetitive traction on the nerve can also produce similar symptoms. These injuries occur over months of repetitive stress or increase in muscle size. The most commonly reported injuries of this type include suprascapular and musculocutaneous neuropathy, long thoracic nerve injury, thoracic outlet syndrome, lateral plantar nerve entrapment, and ulnar nerve neuritis. Suprascapular neuropathy. Compression of the suprascapular nerve with the suprascapular notch produce shoulder pain, muscle weakness, and atrophy. Often this diagnosis is missed. The etiology for the disorder includes impingement of the suprascapular nerve, brachial plexus injuries, direct trauma to the scapular region, dislocation of the shoulders, or fracture of the scapula. Musculocutaneous neuropathy may be brought on by repetitive biceps curl. The pain and weakness are thought to be caused by impingement of the musculocutaneous nerve from the coracobrachialis muscle hypertrophy. That's all for this video. Hope you all enjoyed the content. Please comment down below. Also share, like, and come back whenever we want. It'll be a pleasure to have you back.